wanted to just take a moment to thank you all for the work that you do. And I think this topic more than, well, a lot of them, this is really getting upstream in the prevention piece. Our kids are under so much stress and siege from social media and all these different things that are a danger to them, especially in this time of fentanyl. And so this is really important work and really, I think, an investment in the future of our communities in ways that we cannot measure and cannot understand how this is really important for the future of our communities and for our youth. You know, I'm a big fan of Connect Effect. I actually have stickers from last year still on my computer. And one thing that we're really proud as Region 2 with here in Larimer County, and welcome to Larimer County again, is our 3 school districts have been partnering in ways that we've never had before. We brought everybody together in May of 2022, and now we're going to have the first ever youth homeless shelter opening this first quarter of next year. That would not have happened without everyone working together. Yeah, really great work. The first in a long time in Colorado. And the other things that we do through behavioral health and the Youth Mental Health Task Force and this Connect Effect. And our co-responder, Sergeant Cook, if you haven't seen him running around with the co-responders from Larimer County, we have co-responder teams in this one school district, and we have school resource officers through all the rest. And this is the first time I've seen all 3 school districts working in this arena, and they made sure every middle and high school had a Connect Effect poster up, and that he made them aware of these resources. And Loveland Police Department actually had a fentanyl awareness day, and they incorporated more of the youth and had a Connect Effect seminar and talk about it just a couple of weeks ago with Opioid Awareness Day and Fentanyl Awareness Day. So it's just really, we're seeing this kind of roll along. Region 2, we're very proud. I think we're on our second. We've done 2 grants out, direct impact grants or direct grants to Dr. Riggs and CSU for this training and stuff you're going to hear about today. And we are just so thrilled that he reached out to the chair and mine, the vice chair, and we got on this discussion. And so this all is overlapping, interrelated, but I think is profoundly impactful, and I'm just really glad to have this panel today. So thank you all for being here. I hope that you'll find this information really great. Today we'll have Kent McLennan. Oh, great. I have a phobia of mispronouncing people's names. For Rise Above Colorado, Dr. Nathaniel Riggs from CSU Prevention Research Center, Stella Epstein from a youth panelist, and Dahlia Stenglin? Did I get that correct? Yay! Another youth panelist. Thank you all for being here, and especially for sharing your stories. You guys are really courageous and powerful, so thank you so much. I'll turn this over to you, Dr. Riggs, and have a good afternoon.
Great, thank you. All right, how's everybody doing? We are almost there, all right? All right, one last push. I'm Nate Riggs. I'm the Executive Director of the Colorado State University Prevention Research Center, and I'm going to talk a bit about a really neat collaborative project that we have engaged with at the CSU Prevention Research Center and the 3 school districts in Larimer County, and then more recently with Kent and Rise Above. And so this actually, I'm reminded, this project all got started after I was on a prevention panel in the first statewide opioid abatement conference. And so we got connected with Larimer County and really started to get the work going then. So, what I'd really like to do today is really talk about prevention and talk about how we as a prevention research center can support all of your prevention efforts around the state. So I would like to, sorry, I just got a little sidetracked here. It's 4:15 for me too, I guess. Really want to thank the Region 2 Opioid Abatement Council for this work. It's really allowed us to think big and think about scaling up prevention across an entire region, across an entire county, right? And it's also allowed us to think long-term. Because these dollars are going to be around for a while, we can think about really taking a deliberate approach to scaling up these efforts for long-term sustainability. There's all of us. Now, the first thing that we really wanted to do with our collaboration is really define what we mean by prevention, right? sometimes prevention's a little bit difficult to nail down. And so, a lot of times, sometimes people can think of, treatment and recovery and harm reduction as certainly ideally preventing opioid overdose experiences, right? What we wanted to do with these dollars is to complement those approaches with more upstream work, more upstream prevention, where what we're trying to do is to prevent substance use disorders, opioid use disorders, before they even occur, right? Even before someone might start using substances in the first place. And so those of you who might be in the public health space, you might be thinking, when we think about upstream prevention, we think about primary prevention, right? If you're in schools, talk about early upstream prevention in terms of tier 1 supports. If you're a prevention scientist like me, we think of things like promotion, universal preventive interventions for all youth, or selective preventive interventions for those youth who might be at risk for whatever reasons for using substances, all right? But we're really thinking about this upstream. So I'm going to talk about how we've engaged with the Larimer County Public Schools districts in that. Why prevention? Well, we know prevention works. We know it can save lives, right? It's saving lives in the future, but it is nonetheless saving lives by keeping people from developing a substance use disorder. It can also work for diverse communities. So what we do at the Prevention Research Center is we can work with our community partners, our school partners, in identifying and selecting evidence-based programs that work for you and your community, right? We're doing that in Larimer County. And then, you know what? That whole adage of an ounce of prevention is worth a pound of cure, that's actually true, right? Preventing substance use disorder is way cheaper than trying to treat substance use disorder after it's happened. And I'm going to show you an example of how we're doing that in Larimer County. Okay, in case you forgot, this is where you're at. Here we are in Larimer County. The Prevention Research Center is also working with folks in Douglas County, Region 12, El Paso County and Teller County, Region 16. I know we have some representation from that region. And then down in Region 19 in the southeast corner. So again, if anybody else is interested in talking about how the PRC can help support your prevention work through these opioid settlement funds, please contact us. We are the land grant university in Colorado, and that is our mission to engage our community partners around the state. Okay, so specifically, Region 2. All right, we had this is our second year. In the first year of funding, what we did was we wanted to do some capacity building and some of the work it takes to, the systems change work that it takes to effectively implement prevention programs. So one of the things we want to do is really understand our school districts better and what good prevention work is already going on in those school districts before we started monkeying with things, right? So we scanned all 3 school districts to identify what are the strengths, what's going on, what are some of the gaps, and what are some of the needs related to prevention in each of the 3 school districts. It's pretty heavy lift, okay? But what we could do with that is that now that we know what's going on in the school districts, and now that the school districts know what's going on related to prevention, they can use those scans for strategic prevention planning in future years. And in fact, those prevention scans also inform the work that we are doing in year 2 for this project, and I'll describe that a little bit. We also wanted to create some system-wide approaches to increasing educators' prevention knowledge and awareness. So a lot of times people who are doing prevention are trained, really well trained in what they're primarily supposed to do, right? Educators in teaching. In other delivery systems, they're really well trained to do that, but maybe haven't had a lot of training and education in best practices for prevention. And so I'll show you some of the things that we did there. And then the third goal that we had for year 1 is we really wanted to provide at least some programming for youth, for substance use and mental health promotion. And we did that through implementing the Blues program, and I'll describe what that is as well. All right, so in addition to some in-person trainings that we've done, prevention trainings and professional development with the 3 school districts, we have co-created with Penn State University a learning management system we have prevention training modules that the folks who are implementing those prevention programs in schools can increase their prevention awareness. All this stuff is open access. Anybody in this room can access these trainings. They run from between 30 to 75 minutes. And one of the neat things about these trainings is that educators or whoever engages, we've worked out with Larimer County School Districts, that those professionals who engage with these learning management modules can then get professional development credits that are required for their professional development. So you'll see things like what is prevention science, understanding risk and protective factors. We have some on coordinating youth-driven work and involving youth in prevention efforts. And we continue to build all that stuff out. So we're really happy to have launched that this year. And then here's the Blues program. So the Blues program is a cohort-based, 5 minutes, oh no, okay. The Blues program is a cohort-based, there's 6 to 8 youth go through this program, and it's for 8th graders through 12th graders, and it teaches positive coping skills, and it teaches positive reframing skills. It's the only model evidence-based program that can both promote mental health, prevent depression, and then also prevent substance misuse. So we thought that'd be a great program to implement in the Larimer County School Districts, and I'll show you some exciting results that are a little bit blurry here. So the upshot of this slide here is that even after, so we piloted the program in year 1 with 4 cohorts, and we weren't really expecting the results to be as effective as we find. Generally, in the first couple of implementations, the prevention facilitators are getting their prevention sea legs under them, but because of the training that we help provide those teachers, those educators, we see in the green, we see significant effects on decreasing depression, decreasing anxiety, decreasing negative mood, increasing resilient coping, increasing positive reframing, increasing social coping, and then also increasing student belonging, right? And so the effect sizes there, medium to large, which means the program's working really well and a lot better than we anticipated during the first year of its implementation. Now, of those students who participated in that, I'm not going to go through this entire cost-benefit analysis, but of those students who participated in the program, a third of them went from clinically diagnosable depression to non-clinically diagnosable depression. Okay, and so if you do the calculations on how much it costs to treat major depressive disorder, factor in a couple of other things, including co-occurring substance use disorder, we calculated the savings to the community to be around a net savings of around $97,000 or about $24,000 per cohort. So not only are we preventing depression and preventing substance misuse, we're also doing it in a very cost-effective way. Okay, so really quickly, I've got a couple of minutes to talk about what we plan to do in year 2, because we had those prevention scans in year 1 that told us where the gaps were. So we're going to continue to do the professional development, continue to do the Blues program. Then we're going to start, from here on out, we're going to just start layering on programming that can address community or district-specific needs. So in Estes Park, the Estes Park School District really wanted to focus on serving the Latinx families in the region. And so what we did was we worked with them to select an evidence-based family-focused program called Guiding Good Choices. It's a family-focused program, 5 sessions. I won't go into too much detail, but it's an evidence-based program that can prevent substance misuse, prevent risky sexual behavior, and prevent mental health problems. In Thompson School District, they really wanted to serve students who had already gotten in a little bit of trouble for substances, right? Maybe they've been caught once with using either cannabis, alcohol, or nicotine. And instead of suspending those students, they wanted to take more of a restorative justice approach. And so what we're going to do in Thompson School District is we're going to implement the alcohol, cannabis, and nicotine versions of this evidence-based e-checkup to go program in all 5 of the high schools in Thompson School District. It's a normative feedback, online normative feedback intervention that's been shown to reduce reduce substance use. And then finally, in Poudre School District, what we're going to do is they really wanted to serve the needs of the LGBTQI identifying students in that school district. And let me tell you, it is very challenging to find an evidence-based program that has been developed specifically for the LGBTQI community, but we finally found one. And the goal is by the end of this year to begin the implementation of this evidence-based program called Proud and Empowered. It's an intervention for LGBTQI youth that has been shown to decrease depression and promote mental health among high school students. So this will be year 2, and then again, moving forward, the idea is to then just continue to layer on new programs that can serve these district-specific needs in evidence-based ways. Another thing that we've done in year 2 is we have coordinated with Kent and his team on the Connect Effect, and I will now hand it off to Kent, and that is perfect timing. All right.
Thanks, Nate. Hi, everybody. I'm Kent McLennan. I am the Executive Director of Rise Above Colorado, and I'll take that from you. Thank you. So as Nate said, we're really working to layer on additional resources here in Larimer County and partnering with the Prevention Research Center to do that, and all the good groundwork that you've just heard Nate talk about being laid out in this collaboration. So our organization is statewide. We're empowering youth to make healthy connections, decisions, and change. We work with youth middle school, high school age 12 to 17, all around the state. And so looking forward to sharing with you one of the ways that we're interacting in communities today, and specifically with Larimer County's example. So we're going to talk about the Connect Effect. Those of you that were at this conference a year ago saw the launch and the debut of the Connect Effect back in August in Montrose. And so we had the opportunity at that point to share a little bit of the campaign. So I'm going to give you a quick refresher in case you'd forgotten the audience, and then we'll show you a little bit of the results that we're seeing after year 1. First of all, the audiences that we were going after, really primary age 10 to 14. So we're working on that younger age spectrum, even younger than middle school in some cases, and their parents and trusted adults, while still maintaining a focus with our high school age youth as well. So trying to get something that's working for all that age range is challenging, and there are other things and different things that we're emphasizing at each of those levels. And the campaign objectives, and I'm just going to do a quick shout out to my colleague Eric Anderson from SE2, who was the contractor that worked with the Department of Law and the AG's office and brought us in to kind of bring in the youth perspective on this campaign. So as we're developing all of this and we're continuing to learn and support this campaign, SE2's been right there all the way along. So thank you, Eric, for being here. Our objectives, really, again, this is a positive social norming campaign. And as I think you'll see in the messages, if you haven't seen them, by picking up posters, and that's your plug for picking up posters and stickers on your way out, emphasizing those positive statistics of how youth, not only for themselves, but how they want to support friends. So we wanted to increase their knowledge of fact-based information around fentanyl, the role of being an active bystander. What do you do to support your friends? As a parent of a 14-year-old, I understand how important that friend group is, right? So how we protect our friends and how we take care of them is almost as important as how I take care of myself. Increasing confidence and exercising protective skills, normalizing conversations and decreasing the stigma around having those conversations and around the issue itself, so that's something we can continue to talk about, and a lot of talk about that today, and promoting the power of connection and the role that we all have to play, no matter our age, no matter if we're 10 years old, there's a role that we have to play in this larger conversation. So here's some of the things that you saw from the creative and in some of the original posters. That positive statement, 87% of teens would try to stop a friend from using pills, and we emphasize about pills that can be counterfeit and contaminated and the risks that come with those, and just those normative statements most Colorado teens don't experiment. And that's all coming from data that we've pulled, and we're going to show you some more data here in a second. I want to share some of the results from this campaign as of the first year. So this campaign was running statewide. Began last August, as we said. We've seen 68 million combined impressions across the campaign, 42 million in that youth audience, and then 26 million towards adults. And you'll see the different platforms, notably different between those two audiences. We've seen nearly 400,000 clicks to the Connect Effect website, where all those additional resources are for both parents and youth. So we've been really pleased with the response rate with this campaign. We've been partnering, as Commissioner Shattuck McNally talked about, the partnerships with local communities that picked it up, not only the 19 opioid regions, but we also worked, and SC2 coordinated a mini grant program that engaged other community partners that helped us get this campaign deeper into communities, into some of those communities that are harder to reach beyond just your average schools. And so that's been a really effective piece of this effort. And now I'm going to give you a little sneak peek on some data that isn't publicly released yet. So you're sworn to secrecy in this room. On some of this, it'll be out next week. But we wanted to share with you some of the positive things that we're really seeing happening from data that was collected. We commission a survey every 2 years called the Rise Above Colorado Youth Survey. And we'll show you some of these the impacts with this data of what we saw. This is statewide numbers. So 89% of teens are seeing risk in taking pills acquired online or on the street. That's pretty high. Again, we want to continue to push that people understand there is great risk in that behavior. There is a lot of concern with pills being laced with fentanyl. And we did see an important increase in that rate amongst 12 to 13-year-olds. And that's good because that was an age group that was harder to move some of the data points that we were wanting to see in this survey. So that was a real positive. Interestingly, though, at this same time, the perceived risk of misusing pills is declining statewide. Only 61% saw great risk in misusing pain pills like Vicodin or OxyContin. And so that number we would love to be higher than what it is currently. Bystander behavior, and again, these are some of those normative statements that we're talking about and that hopefully you're going to see in the next iterations of the Connect Effect, where 84% are likely to stop a friend from misusing pills that might be laced. 81% would encourage a friend to quit misusing prescription drugs, and we're seeing more interest in carrying naloxone. We asked them really specifically if they've thought about carrying naloxone. Very simple yes or no question. So more older youth, not surprisingly, are than the younger youth, and that seems, again, relevant to this issue where they may be in situations where they see the relevance of it. So we're pleased to report some of those data points. Some of the other things that go back to the campaign objectives, we were hoping to see awareness go up, and it has. There's been more education happening in the schools around prescription drugs. Since 2022, the last time we did this survey, there was more conversation about counterfeit pills and that, again, fentanyl laced pills as part of these school conversations. We also saw increases in family conversations go up by not a lot, but a little bit. Those increased for prescription drugs to 48%, and around counterfeit pills to half of youth are saying they're having conversations with parents. So the dialogue is out there. That's, again, a part of the reason that parent campaign needed to be part of what we were doing. Campaign awareness is also really high. For our first-year campaign, we were really, really pleased to see the awareness level that 4 of 10 youth are already aware of this campaign. In a brand-saturated environment where there's a lot of clutter and a lot of competition, that's pretty high for a first-year campaign. And we talk about it being sticky with the right people. And what I mean by that is it's hitting the people that we want to reach most, those that maybe have the most room to move and the opportunities, not the people that are, yeah, I wouldn't do that, no, not an issue. It's the people that might be questioning whether prescription drugs are safe or not. That's who we want to be hitting with this campaign. So, the example I give you there talks about those that are, maybe less inclined to try to stop a friend and be that positive bystander. So, some important movement in those spaces. And one of the things with social norming campaigns, this is a long game. This is not something we solve in a year. And in social norming, our goal is to make sure that youth are having accurate perceptions of peer use. And so that's really important in this particular case, to bring that alignment with reality so that there's not that gap of misperception. And we saw, particularly amongst our older age group, more of that happening. We're really excited to be partnering with Region 2, as Nate mentioned, and leveraging the work in the school districts. So this campaign is being localized now for Larimer County. So some of the data that you saw in there is going to have local Larimer County data. It's going to feature local Larimer County youth in the campaign here. So these posters that you see out there on the tables, for Larimer County, we're going to be making our own here with Larimer County data, youth, imagery. We did that actually last week, so that is coming here before the end of the year. And I made this a little smaller than it should have been, but there's some really encouraging data coming out of Larimer County. We oversampled this community because we wanted to pull some of those local data points for this campaign. And there's some really positive findings that where Larimer County's better than the rest of the state in this area. They're significantly less likely to see drugs as helping to manage stress and you see the difference between that statewide and here in Larimer County, and less likely to say prescription drugs are safer than illegal drugs. So there's some good awareness to build on here. 9 out of 10 see great risk in regularly misusing prescription drugs like OxyContin, compared to only 61% in that statewide number, and 9 out of 10 would encourage a friend to stop misusing prescription drugs. So we've got some really positive energy that we can build on with this campaign, and so the goal is to continue to ramp that up with the local campaign messaging. So that's where we are with next steps in terms of getting input. We did a youth focus group last week where we're building in youth input into this campaign so that they can feel good about the messaging that's going out there and that they feel like it represents them. And we're going to hear from some here in just a second. And that's a big piece of the next steps of the campaign. Our goal is with this paid media campaign is that we're going to reach at least 70% of the youth through the social media platforms to be able to get it out there over the course of 5 months between the end of this year and the beginning of next. So with that, we're going to shift over, and instead of talking about youth data, we're actually going to talk to youth. And I think that will be a welcome change from lots of adults talking today. So I would love to have Dahlia and Max introduce themselves, and then we'll kind of jump into some of our questions. And if we have a little bit of extra time at the end, we can take questions from the audience too. So which of you wants to start?
I'm Dahlia Stingline-Huseby, and I'm in 8th grade at Blevins Middle School. And I'm on the Rise Above Colorado's Teen Action Council.
Hi, I'm Max. I'm in 9th grade, and I go to Lincoln Middle School, and I'm a representative for TAC 212.
That's great. Appreciate you guys both being here. Let's give them a little round of applause for being here and being courageous. I know we don't have a lot of time with Max because Max has got a family thing to attend to here pretty quickly. So I want to start, Max, with you. Can you talk a little bit about TAC 212 and how you got involved? We'll talk about community and the impact of that, but how did you get involved, and what's the fentanyl awareness project you've been working on?
The fentanyl awareness project that we've been working on is called Habit, and it is a short film depicting a character who didn't test his drugs and had an overdose due to fentanyl. And I was introduced to TAC by a friend.
That's great. And like, why did you choose to get engaged? What made the difference, and why do you feel like this is an important issue for you?
Why I think it's an important issue for me is because I've had friends and family who have sadly passed from fentanyl overdoses, so I think it's really important to get the word out.
That's unfortunate, but real, right? And let me ask you too, and maybe we'll go through a whole battery of questions for Max, and then so that you can get going if you need to. Tell me a little bit, like, if you were giving the adults in the room advice, how can adults best support youth on this issue and helping to give you guys the tools to be successful?
I'd say help to give the tools to be successful would be groups like TAC, where kids can go and have a sense of like community and a place to go, because it does stop them from going and committing crimes or using party or prescription drug. Can you
just for the benefit of the group, can you describe TAC 212 a little bit too? Like, it's a really cool place. I got to go there last week, and what role it plays in your community?
What role it plays in the community? I'd say it's a good place together, and there's a lot of stuff if you want to explore different hobbies, and we have a great support system there as well.
Yeah, so it's a drop-in space that's really a safe space for youth to be of all ages, right? And there's resources, activities. So if you're interested more in learning the role that TAC 212 plays, Destiny's our representative who runs the center, and it's a great resource for this community, for youth in it. So cool. Is there anything else that you would want to add to share with the group before you have to go? Cool. Well, let's thank Max for being here. All right, so we'll continue on. Thanks, Max, for being here, and we'll talk with Dahlia a little bit more. So Dahlia, you talked about. I'm going to pull up the next slide because I'm going to ask you to comment on this data a little bit, and we talked about this. This is also from the survey that we're about to release, and it talks about this issue of connectedness and youth, and some of the changing data, and the gist of it, as you're trying to digest it and read it, is that what we're seeing in the data is that youth are feeling less sense of connection to their school communities and to their groups of friends over the last 2 years in particular. And obviously we know some of these things have changed with the pandemic significantly, but we're definitely seeing changes here. There are other groups like TAC 212, for example, where that's seeming to be a little bit more stable than it was, and that didn't change in the last 2 years. But this sense of connectedness is important, but it's declining. Tell me a little bit more about like why it matters to have that place where you connect, either with one of those groups, friends or school, or an outside group, and what you think that does for youth.
I think it's important to be connected because as humans we rely on each other. And like when you're connected with people, whether it's your friends, family, or like at school or work, you have a sense of belonging. And that can be hard to get sometimes, especially with social media, because it has like new ways, like our society, that you have to act, behavior, be to be accepted. And when you find like a community, it can help you feel more accepted to that and just feel better inside.
Yeah, I think that's great. And why? What has being involved in a group like our Teen Action Council helped you to do, and as a sort of extracurricular way of building connection?
I think it's helped me to like meet people I share interests with, and it's really like broadened my horizon on issues like this, because before I joined, I didn't know a lot, but they've really helped me like get up to date with it, and it just helps me like educate other people and make sure all my friends in my community can be protected and safe.
So, and tell me a little bit why you got motivated in the first place to join. What was your motivation? Was it those things, or was there something else that motivated you to join originally?
I really love my community and friends, and I think just like having the opportunity to be able to help them and make sure that they are safe really helped me want to be able to do it and be involved.
That's great. So talk to me a little bit more about the Connect effect and the role you talked about keeping your friends safe. And it's a lot of the same values that we really held as a key piece of the Connect effect campaign. How does this campaign sort of resonate, and how do you feel like it can be a, something practical with your groups of friends and the things that you share?
I think the Connect effect is really powerful because it's like, it's not something big. Like if you see a poster and read it, it'll take 30 seconds. But some other things I've seen other organizations do, they're like big posters with like an essay written on them, and it's hard to stop and see it. And I think just having something like as simple as that, but also as meaningful, really helps to get the word out, because that's the things kids pay attention to.
How do you see them accessing it? Like where would you go to get that information? Like, do youth go to websites? Are they getting it more on social media, or do you think they trust like friend groups and referrals and that sort of thing too?
I think it's getting harder and harder to trust social media because of just the things that are on there, because there's some accounts that are very trustworthy, but also like just random people telling you information won't really tell you much. So I'd say a lot of social media, but then that like gives lies. But then like at my school, they have a lot of posters up about resources you can go to, and that really seems to help like spread the word.
So it's good. See, posters work, people. The posters are on the table out there. That's your word from the source. So no, it's important. I think that we recognize that there are old school ways of communicating that are still valuable, right? That it's great to be part of that larger conversation and to inject some positivity into it. I know that's our goal at Rise Above Colorado, and part of what we're doing with our Teen Action Council is they're ambassadors in their communities for some of these positive social norming messages. But it goes to show that it is a combination of different ways, and especially, I mean, you talk about you're in middle school too, so more access and with those in-person posters and good feedback on cut the clutter in the campaign messaging. So Eric, you taking notes over there? Okay, good. So I asked this question of Max earlier, and I'll ask it to you too. What advice would you give adults in the room in terms of how do they best support youth at the stage that we're at, and to be engaged in communities, and then also you can go any direction you want with it, but be engaged or on this particular issue around fentanyl awareness?
I'd say just like getting out there more, because like if someone comes and does like a PowerPoint presentation, most kids won't see it, because kids my age and attention span is about 7 minutes, and that's on a good day. So I think it's better to like have something hands-on or something interesting, or like even like invite some schools to go on a field trip to like a center that talks about this, because that's the stuff that kids will remember. But if it's just like someone comes in, talks for 5 minutes and leaves, it's not going to stick with them. Like if something new and exciting comes up, then that's going to be on their minds, and not with just the presentation that just happened.
So I think we got to think outside the box a little bit, on less on the presentation, a little bit more on the creative ways that we're engaging our young people in this. Awesome, that's great. We've got a couple of minutes. That was the extent of our sort of questions for now, but I think we've still got a couple of minutes left, and we'd entertain sort of questions from the audience for any of us on anything that you've seen, questions you have. Yes. Yeah, I think it's a great question. Hopefully everybody heard it, just related to naloxone and its availability to youth. I'm sorry that Max is not here to actually answer that question. I know in the focus groups that we were doing last week, I know Max was talking about, I always have Narcan on me. because of some of the people that he comes in contact with and the risks and number of people in that group, if I remember, described being in a situation where they needed it or if somebody needed it. So I think, and you saw it a little bit in the data points of some of the older youth being a little bit more receptive and having thought more about it. I think that's part of our intention, right, too, is that older age group having tools to be successful and to take action. And I think for a lot of youth, especially in that high school age, are really interested in being able to do something. I mean, they know it's accessible in most cases at their schools, but their ability to actually have it on hand and being able to potentially save a life if they end up in the worst case scenario, I think has been one where it's empowering, I think, I'm putting words in youth's mouth, but I think it's empowering to them to have some control of being able to be part of the solution, regardless of whether they use or not. Dolly, I don't know if do you have thoughts on that? And you're at middle school, so that's a little bit different.
I think like just having something that can help, and like otherwise you feel so helpless and you don't know when it could happen. And in the unlikely scenario that it does, it's just good to be prepared. Like to know that you have it and that you can help someone if they need it. I feel like that's a really powerful thing to do.
That's great. Thank you for that. Any other questions? Yes. Yeah, so the question, if you didn't hear in the back, is really how do you get the right information, because there is so much misinformation out there. Dolly, you hinted at it too, right, of not knowing, and being as trustworthy of what you see on social media. So I think, yeah, super important, and we're, with the Connect Effect, I know the sources and the information that's on that website, we've researched, we're making sure that we're getting science-based opinions on ensuring that the information's factual there. Same with our Rise Above Colorado website to ensure that those resources are there. Would you add anything to that, and just in terms of making sure what we're getting is the right stuff?
I think just knowing that social media is like not a trustworthy source most of the time can be really helpful to kids.
Yeah, awesome. Well, that's all the time we have. I want to thank, special thanks to Dahlia for her courage in being up here. And thank you all for sticking with us here till the very end of the day. You all are troopers. I hope you gained something good out of this, and we appreciate you. So thank you all.
Just one quick announcement. We have a reception that is following this that was originally by registration only, but we would like to invite everybody to attend. It's going to be at the Blue Arena. We'll have staff by the exit and the elevators letting you know where that is. It's nearby. So please come join us. There'll be food and drinks and networking.